Welcome back to Med Madness, your go-to podcast for all things medical. Today, we're diving into the fascinating world of physiologic changes during pregnancy. Understanding these changes is crucial for anyone in the medical field, as it helps us better support and reassure our pregnant patients. Let's start with the cardiovascular system. During pregnancy, a woman's blood volume increases significantly. Interestingly, the plasma volume increases more than the red blood cell mass, leading to a relative dilution of blood. This is why we often see a decrease in hemoglobin concentration, a condition known as dilutional anemia. Alongside this, systemic vascular resistance decreases, which means the heart doesn't have to work as hard to pump blood through the body. However, the heart rate and cardiac output increase to meet the growing demands of the mother and the developing fetus. Alkalosis. The body compensates for this by increasing renal excretion of bicarbonate. Additionally, despite the expanding uterus pushing the diaphragm upwards, diaphragmatic excursion isn't impaired, allowing for efficient ventilation. Hormonal changes also lead to laxity in the intercostal muscles, enlarging the thoracic cavity and further aiding in the increased tidal volume. Interestingly, this hyperventilation also leads to a slight increase in PaO2. Now let's talk about the renal system. During pregnancy, renal blood flow and urine output both increase. This increase in renal function is reflected by a higher glomerular filtration rate, or GFR, which consequently leads to lower levels of blood urea nitrogen, BUN, and serum creatinine. The kidneys also play a role in managing the respiratory alkalosis by excreting more bicarbonate. Additionally, there's an increase in antidiuretic hormone secretion, which can slightly lower serum sodium concentration. Moving on to the hematologic system, pregnancy creates a prothrombotic state. This means there's an increase in coagulation factors, making pregnant women more prone to blood clots. As mentioned earlier, the increase in blood volume primarily affects the plasma, leading to dilutional anemia. So, how do these changes manifest clinically? Many pregnant women experience mild to moderate dyspnea or shortness of breath. This is usually due to the physiologic hyperventilation induced by progesterone and is generally harmless. However, it's crucial to distinguish this from dyspnea caused by underlying cardiopulmonary conditions. For instance, peripartum cardiomyopathy is a condition that can develop in the last month of pregnancy or within 5 months post-delivery, and requires prompt evaluation with echocardiography. Symptoms of decompensated heart failure, like lung crackles, would warrant this investigation. Similarly, if acute pulmonary embolism is suspected, characterized by hypoxemia, a ventilation perfusion lung scan would be indicated. Now let's bring these points together with a real-life case study. Consider a 28-year-old woman in her second trimester who visits her OB/GYN with complaints of mild shortness of breath. Her vital signs are stable and physical examination reveals a systolic murmur and mild ankle edema. Blood tests show a slightly elevated pH, low PaCO2 and low serum bicarbonate, indicating primary respiratory alkalosis with renal compensation. Her dyspnea is primarily due to progesterone-induced hyperventilation, a normal physiologic response during pregnancy. The systolic murmur is likely a flow murmur resulting from increased blood volume, and the ankle edema is due to uterine compression of the inferior vena cava. In this scenario, no further diagnostic testing is necessary, and the patient can be reassured that her symptoms are typical for pregnancy. In this scenario, no further diagnostic testing is necessary, and the patient can be reassured that her symptoms are typical for pregnancy. However, if she had presented with more concerning symptoms, such as severe shortness of breath, chest pain, or signs of heart failure, further evaluation would be warranted to rule out conditions like peripartum cardiomyopathy or pulmonary embolism. That wraps up our discussion on the physiologic changes of pregnancy. Understanding these changes helps us provide better care and reassurance to our pregnant patients. Remember, while many symptoms can be explained by normal physiological adaptations, it's essential to stay vigilant for signs of underlying conditions that may require further investigation. Thank you for tuning into Med Madness. If you enjoyed this episode, please leave a comment or share your thoughts with us. Until next time, stay curious and keep learning.